The World Health Organization has declared the growing monkeypox outbreak to be a global health emergency. Our Chris Reyes is watching the story from New York. Chris, good to see you. Talk to us about this declaration. What does it actually mean?
Good afternoon, Michael. We should start by saying that Dr. Tedros, the Director General for the WHO, made this declaration, even though the emergency committee tasked with looking at the monkeypox outbreak didn't come to a consensus of whether the monkeypox outbreak was actually a public health emergency of international concern. And Dr. Tedros said he made this declaration for a few reasons. First and foremost is that the outbreak is growing. So, for example, last month, he said that 340 cases of monkeypox were reported to his agency, and now it is at 16,000 from 75 countries. He also said that the outbreak met the 3-point criteria of what a public health emergency of international concern is, including the fact that there is public health concern and risk with international spread, as well as the fact that an international coordinated response is needed. He did qualify, though, that at the moment the outbreak is concentrated in men who have sex with men, especially those with multiple partners. To that, he had this to say.
This is an outbreak that can be stopped with the right strategies in the right groups. It's therefore essential that all countries work closely with communities of men who have sex with men to design and deliver effective information and services and to adapt measures that protect the health, human rights, and dignity of affected communities.
And Michael, Dr. Tedros ended by saying that he does believe that public health agencies have the tools to contain the transmission and to contain this outbreak. So he said this is one of the reasons why he wanted to lay out these recommendations from his agency.
So talk to us about recommendations then, Chris. How is the WHO saying this needs to be dealt with?
Well, Michael, it was a long list of recommendations, but the crux is that there should be a coordinated response from various public health agencies, both at the local and international level. Dr. Tedros also recommended that monitoring of the spread should be intensified and that a campaign should be launched to avoid stigmatization and discrimination against the groups affected by monkeypox. Dr. Mike Ryan, an epidemiologist for WHO, had this to say about how tricky it is to deploy this kind of strategy.
It's very important that we get this balance right. Public health is important. It is very important that we extend the same support to communities that are having to comply with measures, and at the same time that we avoid coercive and excessive measures that are not aimed at containing or controlling the disease, but aimed at isolating or discriminating against a certain section of our population.
And Michael, on the issue of vaccines, that's where the WHO says there's a lot of unknowns, particularly because the current vaccines available for monkeypox right now has not been deployed in this context and at this scale. So they are having ongoing discussions with manufacturers about making supply available and also doing more clinical trials. And now that this has been declared a public health emergency, you can bet that we're going to hear more about it in the days to come.
Chris, thank you for laying that out for us today. I appreciate it. The CBC's Chris Reyes in New York.